Picture this, a relentless bully that assaults everything you cherish and hold dear. That's how one young woman describes obsessive-compulsive disorder, OCD, and, alarmingly, reports of this condition among 16 to 24-year-olds in England have surged more than threefold over the past decade. But here's where it gets intriguing. Is this a true epidemic, or are we just noticing it more? Dive in as we unpack the shocking statistics, personal stories, and the heated debate surrounding what's driving this mental health crisis. According to an in-depth BBC examination of NHS data, the count of young adults aged 16 to 24 disclosing OCD symptoms has skyrocketed. In the fiscal year 2023-24, around 370,000 individuals in this age bracket reported these troubling signs, drawing from the latest NHS Adult Psychiatric Morbidity Survey, released in June 2025. Compare that to 2014, when the number hovered at about 113,000, that's a staggering increase. Now, OCD ranks as the second most prevalent mental health condition among young adults, surpassing even depression in some metrics. To put it in perspective, here's how it stacks up against other anxiety-related disorders based on survey data. Generalized anxiety disorder, GAD 7.6%. Obsessive-compulsive disorder, OCD 5.7%. Phobias, 4.8%. Depressive episodes, 3.8%. This shift underscores OCD's growing prominence, but it also raises eyebrows. Are these figures reflecting a genuine rise, or simply better recognition and reporting of a condition that's always been there? At its core, OCD goes far beyond the common stereotypes of extreme tidiness or organizing socks in precise rows. It's a complex mental health challenge characterized by intrusive thoughts, obsessions, that provoke anxiety, leading to repetitive behaviors, compulsions, aimed at alleviating that distress. For instance, someone might feel compelled to wash their hands dozens of times a day or check locks repeatedly, not because they enjoy it, but to ward off fears of harm or contamination. These symptoms can emerge as early as age 6, often intensifying during puberty or young adulthood. Sophie Ashcroft, a vibrant 22-year-old, poignantly likens OCD to an unyielding tormentor. It targets every aspect of your life that matters, your passions, your relationships, everything, she shares. Her struggles began at 9, but they worsened dramatically a decade later after losing a close friend. To combat disturbing ideas, Sophie finds herself repeating mundane activities, like stepping into the shower or brushing her teeth, over and over. It's like an inner voice insisting you redo that hug or action, and it completely overwhelms you. It's utterly agonizing, she explains. Despite this internal turmoil, Sophie has triumphantly completed drama school, mastering the art of concealing her pain. I excel at putting on a brave face, but behind closed doors, it's pure chaos and dread, she admits. Intrusive thoughts can derail her entire day. A single worrisome idea might convince her that disaster looms. Sophie isn't alone. Numerous young individuals and their loved ones have reached out via the BBC's Your Voice, Your BBC News platform, sharing heartbreaking tales of battling OCD without adequate NHS support. Those fortunate enough to get appointments often face a dire shortage of skilled professionals and proven therapies. Referral waits to London's National OCD Centre averaged a grueling 41 weeks last year, nearly triple the 5-year mark. This bottleneck forces some families to shell out fortunes on private care, with costs soaring into the hundreds of thousands. And this is the part most people miss: the devastating ripple effects on families. One anonymous mother from southern England recounts her autistic daughter's OCD onset at age 10. Now 17, the girl's condition has escalated severely, leading to multiple hospitalizations and a sharp decline from academic excellence to profound isolation. Our family has been shattered, not only by the disorder, but by a healthcare system that seemed incapable or unwilling to intervene promptly, the mother laments. She argues the UK is letting down its youth with OCD, citing insufficient specialists, inpatient beds, and options. Her daughter, too ill to attend sessions or even take meds consistently, embodies the crisis. Even when treatment is accessible, it might not suffice. Graham and Marie Fuller from Norwich detail their daughter's hospitalization at 12, followed by a frustrating cycle of treatments and relapses through NHS channels. Desperate, they turn to a pioneering deep brain stimulation (DBS) procedure in Texas, a surgery implanting electrodes to deliver electrical signals that modulate OCD symptoms. Though approved in the US, the UK's National Institute for Health and Care Excellence, NICE, restricts it to research due to limited evidence on safety and efficacy. This ordeal has drained us all, but we had no choice, Marie says, noting her daughter's prior contemplations of ending her life in Switzerland. Now 20 and back at university, the treatment shows promise, but it's still early. This highlights a controversial gap. Should experimental therapies be more readily available when standard care fails, even if evidence is thin? Why this explosive growth in OCD among the young? Experts point to heightened awareness, encouraging help-seeking, but charities and sufferers finger deeper societal ills. Lee Wallbank, CEO of OCD Action, paints a vivid image of youth trapped in a pressure cooker of financial woes, academic stress, and global crises like climate change. Fueling this pot from below is social media, she asserts. Meanwhile, Mind's Minesh Patel links the COVID-19 pandemic to amplified strain, with disrupted routines, inverted social norms, and an obsessive focus on cleanliness exacerbating symptoms. Barriers to support further dismantled coping strategies during lockdowns. NHS interventions for OCD include specialized talking therapy like cognitive behavioral therapy, CBT, often paired with exposure and response prevention, ERP. ERP gently exposes patients to their fears while blocking compulsive responses, gradually reducing anxiety. Antidepressants may also be prescribed. Yet, access is spotty. Sophie's GP suspects OCD, but after 2 years, no specialist diagnosis. She's midway through limited CBT, terrified of its end. What if the horrors resurface? How will I cope, she worries. Critics like Wallbank slam the government for neglecting quarterly OCD data collection and outcome tracking, unlike other disorders, leaving the NHS blind to the true scope and inequities. Inquiries to devolved nations revealed no such data collection. The UK's OCD guidelines, outdated since 2005, are under NICE review to incorporate new tech and meds, but Wallbank demands urgent funding. This crisis is avertible with investment, she urges. The government counters by pledging a turnaround, 8,500 new mental health staff, expanded talking therapies, and school-based teams via the NHS app. They've boosted funding by £688 million to mend a neglected system. South London and Maudsley NHS Foundation Trust reports slashing waits from 41 to about 20 weeks, aiming for 12 to 16 by early 2026 with extra resources. But here's where it gets controversial. Is social media the villain in the story, amplifying pressures and triggering obsessions, or a tool for raising awareness and connecting sufferers? And should radical treatments like DBS be fast-tracked despite risks, or is the focus better on prevention and early intervention? What do you think? Do societal pressures and digital platforms deserve blame for the OCD surge, or is it more about improved detection? Should the NHS prioritize OCD data and experimental therapies? How has mental health awareness changed your perspective? We'd love to hear your views. Agree, disagree, or share your experiences in the comments below.